Muy buenos días, good morning, bonjour, bon dia. We would maybe allow just one more minute because we have many colleagues that are entering the Zoom room and we would be starting. Bueno, muy buenos días de nuevo, good morning. Primero que nada,
Good morning again. First of all, I would like to tell you that this event has simultaneous interpretation into Spanish and English. So, as you know, you can select your preferred language with the world icon you have in the lower part of your screens. And now, yes, from PAHO, we welcome you to the webinar of MHPSS, Mental Health and Psychosocial Support, Emergency Preparedness and Response. The webinar is one of a series titled Basis for the Change of Mental Health in the Americas. My name is Carnaez Martinez Viciana. I am a regional mental health and substance use advisor at PAHO, and I have the pleasure of being here today with you moderating this event. The webinar will be recorded and will be available at the organization's YouTube channel. We will give you the link in the chat and other links also for the webinar series, and specific, in particular for this event. You will also have it available in both languages, English and Spanish. We will now present the agenda for today. We invite you to be with us in the following 90 minutes. We will make presentations, and at the end, we will have time for Q&A. And we hope to be able to delve into some aspects of the presentation that you think that are more relevant and that could also help to clarify some elements. Please use the chat to introduce ourselves or make comments with the rest of participants. And the Q&A function, use it please for any questions or concerns so that we may address them at the end. So please input your questions in that application, Q&A, that allows us to organize ourselves. Now, yes, we would like to start with the welcome words by Dr. Renato Oliveira Sosa, our Chief of Substance Use in PAHO. Go ahead. Thank you very much, Carmen. Good morning and welcome back to the webinar, Mental Health and Psychosocial Support, Emergency Preparedness and Response. This event marks the fourth meeting of the series, Foundations for Change in Mental Health in the Americas, organized by PAHO. Today, we focus on a crucial issue, emergencies. These can be health emergencies, natural disasters, armed conflicts, or migratory phenomena, and they entail significant suffering with clear psychological impact. This year, the United Nations Health Assembly approved a resolution to strengthen mental health and psychosocial support at all stages of emergencies. It is essential to note that almost everyone experiencing an emergency will experience some form of psychological distress. And it is likely that 1 in 5 people will have a mental health condition. For this reason, PAHO promotes mental health and psychosocial well-being through emergency preparedness and response strategies. In addition to defending the human rights of people with mental health problems and psychosocial disabilities. During the webinar, we will hear from experts in the field about the importance of mental health and psychosocial support during emergencies. We will address the need to establish a robust and comprehensive preparedness and response system for MHPSS, along with effective intersectoral coordination. They will also receive guidance on the essential principles and criteria for emergency response. We would like to express our sincere appreciation for your participation, which is fundamental to the success of the event, and the valuable support of our country offices in the region of the Americas, and the continued support of ministries of health and colleagues from other organizations. We trust that upon completion, you will gain new tools and knowledge that will inspire all of us in emergency preparedness and response, thus contributing to the transformation of mental health in the Americas. Thank you for your commitment and have an excellent webinar. Thank you very much for your introductory words, Renato. These allow us to address the topic and to motivate us to continue deepening our knowledge. The theme of mental health and psychosocial support has been addressed intensively lately, especially since the COVID-19 pandemic, but there are still aspects that we need to continue enhancing, and we need to work to translate those aspects into actual implementation. That is why we wanted to address some fundamental aspects today. Now, yes, I would like to introduce our first panelist, a great world expert specialist on the team, Inka Websker from Geneva.
She has a PhD as well as a master in public health, with 10 years working in humanitarian crisis, before joining WHO 5 years ago. She's going to present about mental health and psychosocial support, emergency preparedness and response, with key concepts and guidance. Please, Inka, the floor is yours.
Thank you so much, Carmen, for having me. I will now provide a brief conceptual overview of what we mean by mental health and psychosocial support, emergency preparedness and response. So why is preparing for and responding to MHPSS needs in emergencies important? I want to start with the definition of mental health and psychosocial support, or MHPSS, as we say in short, which is really a composite term for any type of local or outside support that aims to protect or promote psychosocial well-being and or prevent or treat mental disorders. So it's really a broad term that we use. And so what is the impact of humanitarian emergencies on mental health? Humanitarian emergencies bring a lot of risk factors for developing mental health conditions, such as, of course, stressful and potentially even traumatic events, loss of livelihoods, displacement, loss of social support networks, but also enduring hardships such as poverty. Most people affected by emergencies will experience distress, such as feeling anxious, sadness, hopelessness, difficulty sleeping, and that is very normal. And for most people will improve over time, especially when support and basic needs are provided. The prevalence of mental health conditions globally is about 12%. But research has shown that for people who have been affected by humanitarian crises such as conflict, that prevalence is 22%, which is almost twice as much and quite high. For children, the stress of humanitarian crisis can affect their cognitive, emotional, social, and physical development, and that can have consequences reaching far into adulthood, such as lower educational achievement, impact on employment, physical health problems later in life. I think we lost the presentation, by the way. I can keep going. Anyway, so why is responding to MHPSS needs important in emergencies? As I mentioned, the needs are high, with so much of a higher prevalence of mental health conditions that we have in such settings. Also, people with severe mental health conditions, sorry, we're on slide 5 now. People with severe mental health conditions are especially at risk. They may be left behind, or they may not have access to basic needs in mental hospitals or other institutions where staff may have fled or supply chains are interrupted. Also, all mental health problems impact a person's ability to function and do their day-to-day tasks. But good mental health is actually critical for coping with and recovering from humanitarian emergencies. So we do need to pay attention to mental health. Yet at the same time, we're still on slide 5. Yet at the same time, resources are often low. There are typically low national capacities of mental health systems and human resources. South Sudan, for example, only has 1 psychiatrist for 5 million people, which is not enough, even without the humanitarian emergencies. And even when mental health resources are higher, staff in emergencies may be affected themselves, or they may be displaced, leaving mental health systems unable to meet the needs. In addition, MHPSS is often not considered or underfunded in the humanitarian response. All the needs are usually high. Food, water, shelter, everything needs to be provided urgently, and mental health can be forgotten. So mental health needs additional advocacy. And now we do go to the next slide, which is number 6. What needs to be done to address MHPSS needs? And we can go to the next slide, number 7. Who should respond to these needs? Figuring out who should respond is really important, and this is where coordination is really critical. MHPSS is not a sector or a cluster, but is relevant across different sectors, or as we say, clusters or areas of responsibility. Of course, health, but also protection, education, and other areas such as nutrition, camp management, or shelter. And this is why it's recommended to establish a MHPSS technical working group or similar coordination mechanism which functions across sectors and can make sure that everyone understands that they have a role to play in addressing MHPSS needs. And there on the slide, you can also see the MHPSS Coordinator's Handbook, which gives you guidance on this multi-sectoral coordination. Now we can go to the next slide. On how should we respond to MHPSS needs. Some of the principles include to promote human rights and dignity, which means to especially pay attention to people with severe mental health conditions who can experience human rights violations, especially in institutions, but also ensuring that affected populations are actively involved in decisions about the humanitarian aid that is provided. Also, doing no harm is an important principle. There are often good intentions in those responding to emergencies, but it's important to provide aid in a way that is done with evidence-based guidance in mind. Also, upholding accountability to affected populations includes getting feedback about what is offered, building on available resources. Rather than just bringing in new people to provide MHPSS, we have to see who in the community could support. What are the existing systems? Who can we work with to build up their skills? This also relates to developing integrated support systems. Rather than creating parallel systems for mental health, we need to integrate MHPSS with existing health and social systems. Also, adopting a life course approach means including, for example, older persons who are often forgotten. And we need a gender responsive approach, given that women often face additional barriers in accessing MHPSS activities and services. And now we can go to the next slide, which is about how to integrate MHPSS with preparedness. Many of you are probably familiar with the concept of building back better. So using emergencies and the attention and funding that comes with them to build back better mental health systems. And there's a WHO publication there on the slide which shows many different country examples. However, we should not forget that also we need to build better before. So investing in preparedness now can actually save us time and resources later when we have to respond to an emergency. And it's especially important to proactively work on preparation and have, for example, a planned coordination mechanism for MHPSS in place, which can then be active throughout the response. At WHO, we also have the Mental Health Action Plan indicator, which has a global target that 80% of countries will have a system in place for mental health and psychosocial preparedness in emergencies or disasters by 2030. However, the baseline as of 2020 is only 28%. So we still have a long way to go. WHO is currently developing the READY package, which is for MHPSS preparedness and risk reduction, and that will be available soon. Now we can go to the next slide, which actually Renato already mentioned. This very historic milestone, which was the adoption of the resolution on strengthening MHPSS before, during, and after armed conflicts, natural and human-made disasters, and other emergencies at the World Health Assembly in May. So this really shows the increased interest and commitment to this area of work among member states. Lastly, I also want to mention some key guidelines and resources on MHPSS, and we can go to the next slide, which shows, first of all, the Mental Health and Psychosocial Support Minimum Service Package, or we can say MSP for short, which is also available online, available in Spanish as well, and which lists which MHPSS activities should be done in every single emergency. What are the priority activities that we need? For each of these, you will also see guidelines and resources in different languages. So the MSP website is a great one place to go where you can find links to everything. You will also see there the just published field test version for MHPSS assessments in humanitarian settings, which will be in Spanish in about 3 weeks. You also see there a WHO evidence review on the mental health of refugees and migrants, which includes many important considerations and recommendations to address MHPSS among these populations. We also have more guidance on MND in emergencies, on climate change, on preventing suicide. And the last two publications, the World Mental Health Report and Mental Health Action Plan, are not specific to emergencies, but are important to know about as an overall framework which we should consider for strengthening mental health systems and working with governments in the short and the longer term. Lastly, I just want to mention also the Open WHO training platform, where we have an open course on MHPSS in emergencies that is also available in Spanish, can be taken at your own pace on the website, and anyone can access it. And that is it for me. Thank you so much.
Thank you very much, Inka, for this very fruitful presentation. I think that you were sharing with us these key elements that we should take into consideration in MHPSS from the preparation side until the response, including the coordination, and also it was very helpful to see the resources that are available. I would like also to add that we have a website specifically on MHPSS as well in our PAHO website. We can copy paste now also these links in the chat. And again, thank you very much, Inka. As you all know, please use the Q&A if you want to do any question to Inka, and we will try to have some time allocated for that at the end of the presentations. So thank you again. Ahora voy a volver a pasar al español.
I will switch back to Spanish now. I would like to invite the next panelist, Luisa de Nobrega from Venezuela. She's a clinical psychologist, graduated from the Central University of Venezuela, postgraduate in Lacanian psychoanalysis, currently MHPSS coordinator of HIAS Venezuela and co-leader of the MHPSS TWG of the health cluster, trained and certified by PAHO in MHGAP, IPT, EP+, and SH+, with 20 years of experience in design, implementation, and evaluation of mental health and psychosocial support programs for vulnerable populations. She will make a presentation about community-based psychosocial support, context of sustained emergencies, and specifically the HIAS project in Venezuela. Luisa, you have the floor. Thank you. Good morning. Thanks for the invitation and for everybody for being here with us. I will talk about the community-based SMAPS in sustained emergencies. In Venezuela, my country, there are highly vulnerable people. Our reality is typical, and this dates to quite a few years back. But first of all, I would like to start presenting the organization at which I work. Luisa, sorry for interrupting. Can you upload your presentation in presentation mode, please, so that we can see it more clearly? IS is a humanitarian organization that works in more than 20 countries, serving refugees and asylum applicants to help them to reconstruct their lives on different aspects such as legal protection, response to VGB, etc. In Venezuela, HIAS is a civil not-for-profit association that has been operating in Venezuela since 2007, protecting refugees and local population, helping them to rebuild their lives and ensure that they are treated with dignity and respect. And HIAS Venezuela offers a project coordinating all the SMAP's responses. MHPSS, we are members of the TWGH MHPSS, and we have a co-leadership with other organizations. With earlier response, we take into account humanitarian needs, and we also have a needs assessment in-house that we conduct annually. And the sustained response in community-based MHPSS space addresses gender, legal protection, and other areas to strengthen community resilience. We will see each of these phases in more detail. In the preparation and coordination, as I said, IAS is a co-leader with two other organizations of the technical working group of TWG, PAHO and IOM. And we work at the health cluster. This is a space where more organizations are accessing, implementing MHPSS interventions in the country. We coordinate all this in the area of MHPSS, working with our liability and ethic approach. We have formed tech working groups formed by different member organizations, and we conduct actions in the guide of the permanent committee of the three organizations and the ASC manual. We have a significant commitment to improve the humanitarian response quality in Venezuela, to utilize resources for the MHPSS implementation, avoiding duplication of efforts. And our final goal is to save lives and alleviate suffering, preserving dignity. As to early response, HIAS Venezuela, as I said, every year we conduct a needs analysis that in different priority areas in the country to assess all factors that are impacting those places, with emphasis on legal protection, MHPSS, and gender protection. We have different tools that we deploy in the different places. These tool categories have to do with demographic identity, socioeconomic conditions, access, and right to essential services, gender, psychosocial health, gender-based violence, childhood protection, and other vulnerable groups or groups with specific needs, and WASH needs, with the WASH acronym, and particular care requirements for affected peoples. This tool is a collective element based on the technical team and people acting on the ground. And we ourselves conduct this survey at communities, and this allows us to identify what adjustments we need to make in our implementation and determine what are those needs and those risks that have to be addressed. We need to assess that directly. For HIAS, it's very important to know these needs, to have refine the implementation of its activities in the country. This sustained community in community IS has an entrance to prioritize communities with full teams. When there's not when I talk about a comprehensive team, I refer to an interdisciplinary team that covers different programmatic areas such as legal protection, MHPSS, livelihoods, and other needs, recognizing the community needs and coordinating other actions with other agencies or organizations that act in the community. We start with information and accountability, which is a cross-cutting element all over the implementation, and this space in which the community is informed about the scope of the project, how long we will be there, what type of interventions we will do. All of this is fundamental.
After that, having identified the community leaders, we get into training, and we want them to get acquainted with the psychological support so that later on they can begin to work. For us, it's very important with this methodology to take into account the structure, the worldview of the communities where we're working. So we work with these community leaders to make adjustments taking into account the type of language, the language itself, also the communication channels that exist, the type of information that's available in the community itself. And with that, we can use implements, tools to implement in the field. And that way, communities feel that they are that we're part of their everyday life and that we're part of the context within which they live. Later on, once the leaders have finished their training, we provide technical support on the part of the psychologists that work with MHPSS, and we support them until all of these leaders become autonomous once they have what we call installed capacity. Once we're sure that they're people that can replicate the methodology that comes from the World Health Organization, so they can identify vulnerable persons. And we make certain that they have the tools so that they can refer people to specialized MHPSS services. So it's then when we say there's installed capacity. There has been a training process. Also, there has been a support involving technical support. There is the information that they acquire bit by bit. And there's also a services mapping done so that they know what organizations are working within the community. And also, They know that these are places where they can refer people to for more specialized services at the fourth level of the pyramid. Here you can see a representation of what I was describing. So first we have that training of leaders, then there is psychological first aid, that is second step. That is level 2 of the pyramid, and it has to do with strengthening the community. Then later on, in our actions that are adapted to the community, where we replicate and we take into account the reality of the border communities, the indigenous communities, there we make special adaptations to make certain that this is a vehicle to deliver true well-being to the communities. So the leaders can become persons delivering psychosocial support. These are low-intensity interventions, and they work with vulnerable groups, like, for example, women who are alone but are head of household, the elderly, the peoples with disabilities, also the people that have returned to their community. And here we're talking about level 3 of the pyramid, and that has to do with non-focused MHPSS services. Also, we do a mapping of services. That's important for the communities. It's important because they need to know what organizations are available, what organizations can provide services that we can refer people to if they require level 4 care. Now, I wanted to share with you some lessons we have learned. In the technical working group of MHPSS, we have learned several lessons. First of all, we have learned that strengthening capacities is essential in order to have a sound implementation of MHPSS. And also, we have to provide a space for discussion and exchange amongst organizations implementing MHPSS. We also have to do a multisectoral needs evaluation. That is something that we do systematically here in Venezuela. That allows us to get much closer to the communities, get to know them in advance. And we, by engaging with the communities, are able to immerse ourselves better into the community. And in that way, we can work in harmony with the communities. We can thus fit in much better, and that is something that is going to facilitate our implementation within the community. It is good for us to have participation on the part of the community. It's important that we be accepted by them. This makes it much easier. Also, it's important that we develop linkages with local players. That reduces the implementation risks, and it makes us more effective in the communities where we work. Detecting needs allows the technical team, the implementation team in the field, to stay up to date and to work within a clear concept of reality, and also noticing any changes within the community. When we talk about implementation per se in the field, these years that we have been implementing the program here in Venezuela allows us to say that scalable methodologies of WHO are effective interventions. They are evidence-based, and it makes it possible to deliver a true response to people that have been affected by a crisis. In Venezuela, the scalable methodology in communities have had a great impact on people, and the number of people attending meetings with leaders, they recognize these leaders as deliverers of psychosocial support, and we see more and more people working with them. Now, once we have withdrawn from the community, the people still stay in contact with the leaders. So this is truly leaving behind installed capacity in the community where we have worked. Also, knowledge of the communities, involvement of people is key, and it allows us to adapt to a specific context, culture, or language groups. That is very important, that there be adaptation on our part. We also want everyone to see our mental health approach to be of interest to the community. We have to facilitate a resilient response to adversity to strengthen psychosocial tools in people. And this also provides greater control and problem-solving skills for practical and routine problems. So in this way, we have well served the community because our training does give people straightforward tools that help them deal with adversity in a more resilient, healthier way, and thus better manage their own emotions and to strengthen their ability to deal with stress. We see that this methodology makes it possible to create short-term changes, and that allows people to continue to use these tools and to keep those tools alive. All of this is a way of increasing the well-being of the people that participate in implementing MHPSS. So I would like to share with you a video by a colleague, and here you're going to see the work done by my colleague. She works with the leaders in a community here in Venezuela. It's called San Cristobal, and it is in the state of Ganchi. I will not be interpreting. There are subtitles.
Cristóbal. La idea es ofrecer herramientas básicas de apoyo psicosocial a todas nuestras comunidades priorizadas.
Bueno, es facilitar primeramente una ayuda psicosocial, brindando el apoyo a todas aquellas personas, hombres, mujeres, adultos, tercera edad, quienes necesiten una ayuda o un apoyo psicosocial, que no tengan la posibilidad de ser escuchados, de ser atendidos, y brindarles ayuda inmediata. Como líderes comunitarios, pues estamos prestos a servirles y ser la conexión ante el ente para la cual estamos siendo voluntarios, como lo es HIAS.
Con mi ejemplo, pues yo puedo ayudar a las demás personas porque se van a sentir seguras de que si yo pude lograrlo, les genero confianza en de que ellos también van a poder salir y ayudarse con las herramientas que uno les va a brindar. Para HIAS Venezuela es importante empoderar a la comunidad en estas herramientas básicas de apoyo psicosocial de forma que le permitan manejar sus problemas prácticos y emocionales. Hoy nos encontramos en la comunidad del Tabacal, municipio Junín del estado Táchira, junto a las líderes comunitarias, quienes han sido capacitadas en diferentes herramientas básicas de apoyo psicosocial, tales como primeros auxilios psicológicos, en tiempos de estrés a lo que importa y enfrentando problemas plus grupal, de forma que puedan ser la voz nuestra en las diferentes comunidades y brindar ese primer apoyo psicológico a todas las personas quienes participan en estas actividades.
El taller de hoy se llama En tiempo de estrés a lo que importa y fue brindado a 30 mujeres que decidieron brindar a ellas mismas esa oportunidad de obtener cambios en sus propias vidas.
En tiempo de estrés a lo que importa está basada en 5 herramientas: poner los pies en la tierra, desengancharse, actuar de acuerdo a tus valores, ser amable y por último dejar espacio.
Es verdad, a veces nos sentimos temerosos a ser juzgados, pero no tenemos que sentirnos así. Al contrario, tenemos que abrirnos, porque si no nos abrimos vamos a crear más conflicto en nosotros y es donde vienen algunas enfermedades o algunas depresiones que realmente nosotros deberíamos más bien irnos a buscar una mano ayuda. Eso sería lo más importante, la mano ayuda de nuestros líderes en cada comunidad.
También tenemos enfrentando problemas plus, que es con personas en adversidad, que viven aterrorizados ante cualquier circunstancia, mediante los ciclos que han venido viviendo y las circunstancias que se han venido sucediendo, pues se complican, pero de verdad que esta herramienta como líder comunitaria en la que he podido aplicar en los grupos ha sido excelente y ha obtenido resultados. La gente ha vivido agradecida, ya me dicen que han sido buenas, que las ponen en práctica y así ha sucedido.
Porque ayudándome a mí puedo ayudar a otros, y en nuestra comunidad como líder comunitario pues tenemos nuevas herramientas para tiempos de dificultad, tiempos de estrés y hacer lo que importa.
Muchísimas gracias.
Thank you very much.
Muchísimas gracias a ti, Luisa. Muchas
Thank
gracias
you,
por
Luisa.
compartir
Thank
esas
you very much for
experiencias
sharing
tan
those
valiosas.
very
Quiero
valuable
también
experiences. Also, I wanted to
saludar y comentar que
say that
conjuntamente con Joyaira Lugo, que está
you
siendo
have been
líder
working with Hoya Alua and the rest of the highest team. They are really doing very valuable work. Luisa has told us about this organization's experience in Venezuela. There's a strong community base there, and they have worked on doing coordination of mental health and psychosocial support by leading the technical working group. And I would say that they have made key progress in the integration. I was saying to the group just a few days ago that about 4 years ago, at the global level, we were talking about the importance of that coordination. Of course, in all countries, and also in countries where the context is like Venezuela's, there it's absolutely essential. And we began to see that this is possible. And so it's good that you share that experience with us. And thank you for the lessons learned. That definitely is important input for other countries. So thank you very much for sharing with us, Luisa.
Now let me switch again to English to introduce you our colleagues from Guyana. I will introduce you Ms. Leanne Kendall. She's Assistant Dean, colleague of Behavioral Sciences and Research of the University of Guyana, Torqueyen campus. Ms. Leanne Kendall is a lecturer at the University of Guyana, Torqueyen campus. She's graduate of education, sociology, and psychology with skills and experience in providing psychosocial support and the teaching of sociology, psychology, and research. She has been employed as a lecturer at the University of Guyana for over a decade and is currently the Assistant Dean of the Colleague of Behavioral Sciences and Research. Thanks, Leanne. And also Mrs. Sharon Dial, Senior Guidance and Counseling Officer. The senior, she's at the Ministry of Education, is committed to improving the lives of those under her guidance. She holds a Master of Arts degree in psychology and a social work degree. As the former president of the Guyana Association of Professional Psychologists, she led efforts to advance the field of psychology for the betterment of the society. The association played a pivotal role in the technical working group and provided essential support in the fight against mental health challenges. Her primary goal to empower her clients to achieve holistic well-being across all aspects of their lives. I will hand over now the word to Sharon will start will start the presentation, and Sharon will continue talking about the strengthening of the Guyana's mental health system as an examination of the efforts of MHPSS technical working group. Please, colleagues, the floor is yours.
Awesome. Good morning, everyone, and thank you, Carmen, for that introduction. This morning, we are going to be focusing on strengthening Guyana's mental health system an examination of the efforts of our MHPSS Technical Working Group. Can you confirm that you can hear me clearly? Excellent.
Yes, thank you, Lian.
So before I get into content, I'm just going to provide a brief overview of where we are speaking to you from. We are from Guyana, familiarly known as the land of many waters. We were formerly known as British Guyana, and we're the only English-speaking country in South America. Our neighbors are Brazil, Suriname, and Venezuela. 90% of our population lives along the Atlantic coast, and to a larger extent, we're covered by dense rainforests in the southern part of our country. The picture you're seeing before us is a representation of what our people look like. We're quite diverse. We have 6 ethnic groups: the Africans, the Indians, the Amerindians, the Europeans, the Chinese, and the Portuguese. This morning, our presentation is going to take the structure you're seeing before you. We are going to briefly underscore why it is important that mental health and psychosocial support during emergencies is addressed. We're also going to touch on the need to establish a robust and integrated MHPSS preparedness and response system, after which we're going to highlight the essential principles and criteria that should guide emergency preparedness and intervention. We're then going to share some of our experiences and best practices, and then we're going to conclude with some recommendations. In any society across all peoples, on a regular day, our mental health is important. We need to ensure that we're physically well, socially well, and mentally well. So imagine what happens when people are traumatized. It is important that people who need help, people who have experienced a disaster, it's important that their mental health and their well-being is supported. So it is only fair, it is only obvious actually that, you know what, the mental health of those who are experiencing some type of disaster needs to be taken into consideration. And this takes us into the local context of what we did to establish an integrated way of looking at MHPSS and our preparedness and response. Locally, PAHO played a critical role in this. PAHO was actually the convener for this in the Guyanese context. They convened this process by reaching out to several public organizations and private organizations. So what happened is that they sent out invitations to these organizations, inviting them to an introductory meeting. They would have identified who they wanted their representative to be, and subsequent to this, we had weekly meetings. And at these weekly meetings, we would have streamlined what we wanted to focus on and how we wanted to tackle emergencies. We also went about focusing on a mapping exercise. And this mapping exercise allowed us to know who was where, when, and doing what. So this was a very critical aspect of what the working group did. And as we try to sort this through, we also created our terms of reference. And these terms of reference, they were developed and they were finalized in consultation with members of the working group with support from PAHO. Continuing, as we focus on being prepared for an intervention in an emergency, it is critical that some key principles are highlighted. And for the purpose of our presentation, these are the ones that we felt were critical. The first thing you need to do, have a robust plan of action. What are you doing? Where are you doing it? Having this robust plan sets the tone for people on the team to know exactly what needs to be done and how. In addition to that, who is on the team? We need to have people who are experienced, not only in content, but also people who would have had the experience on the ground, who know what to do in times of emergency and can jump in based on working with diverse populations. In addition to that, teamwork needs to be critical. It's not only finding people who know what to do, but people who can gel well together. And in looking at teamwork, of course, communication comes into play. Are we being assertive? Do we know exactly how this needs to be streamlined? Do we know exactly how that needs to be streamlined? So these were the essential principles that we felt needed to be shared in this context. Continuing, as we were planning for the outreach that we're going to talk about in this particular presentation, of course, how it is planned and organized needs to be underscored. So essentially what we did in Guyanese context, we organized the consultation with our Civil Defense Commission, the CDC, and a formal report on the flood situation was presented to the members of the technical working group, the MHPSS technical working group. So this proposal was presented to the CDC for their concurrence, and we then identified who from the technical working group will actually head out into the field. So team leaders were identified, and we organized how we're going to move forward in collaboration with administrators from the shelters that were affected by the flooding. Of course, we can't make a move without funding, and this is where PAHO played a critical role for us. So funding was provided by PAHO and the Ministry of Education, which essentially allowed us to have a successful intervention. I am now going to hand you over to Ms. Sharon Dial, who is going to share with you the experiences and best practices from our intervention. Ms. Dial, over to you.
Thank you, Ms. Kendall. And good morning, everyone, again. Thanks for the brief introduction, Ms. Carmen. Continuing along with the title, Strengthening Guyana Mental Health System and Examination of the Efforts of MHPSS Technical Working Group. The Technical Working Group embarked on a journey to Region 5, which is between Berbice River and Kokwani, Region 10, as those areas were severely affected by flooding. The team fearlessly provided psychosocial support and essential interventions to displaced families and communities and would have gained first-hand experience with the flood situation. A brief of Kokwani. Kokwani is home to more than 4,000 people and is located along the bank of the Berbice River. The main economic activity there, as we're noticing in the picture there, is logging and mining, since it's many gateways to the interior of Guyana and can be accessed by both water and land. Moving along, here's where you see the before and after picture of what Kokwani looks like and what it was after and during the flood activity. The water is there. A lot of families were displaced due to the flood. And so we had to move swiftly. And in order to do that, we collaborated with PAHO and other stakeholders, which played a critical role in assisting during this flood situation. Again, this is another slide here of how high the water was. Families were trying to get out of it. However, it was a bit difficult nonetheless. With the help of all the stakeholders, we were able to move them to higher grounds because this is what they're accustomed to, and displacing families and adjusting to all that has to be done to the new environment and all the changes can be impacting on people's lives. So again, this is another picture here where families were displaced. And again, you see persons moving to higher ground there, moving their items in higher grounds there. You see all the drinks cases, maybe this was a shop at the point in time. And so all those things had to be put higher up because of the height of the water, the flooding here. Okay, Kokwani, introductory session with the media. We would have, as we arrived there, we met with the media and we outlined our activities that we wanted to conduct with the communities and the shelters. We also highlighted the purpose of the MHPSS Technical Working Group with the community. We had representatives from different agencies or various agencies providing an overview of the role that they're about to play at the shelters. The concept of the MHPSS was discussed. Community members were encouraged to access selected services that would be provided because it was over a 3 days period that the activity took place. Here we have the MHPSS on this slide, activities with adults and children. We would have hosted one-on-one psychosocial sessions with the residents of the Kukwani Primary School because there's where the shelter was. We had group counseling activities with the parents and the children between teenage and young age groups. We also distributed pamphlets on self-care and coping skills, as well as distributed stress balls for the parents of the shelter to help them better deal with the stressful situation as it was at the time. Here on this slide here, we have the shelter management, you have the managers there. We also have some stakeholders who were a part of the activity and just getting a briefing of what has to be done, who to meet, and so forth. So it was just a communication aspect there, but the shelters, this is what it looks like. They had beds, they had food stuff, personal hygienes and all the like. Here is where we had counseling, HIV counseling and testing. Persons, and this was done by an agency, and persons were very receptive, they were eager, and this was a success as well. In addition to that, we would have met with the parents, and we have our very own Dr. Roberts there sitting, addressing and speaking with the shelter persons there, and as well as other stakeholders, reaching with families and friends and so forth, just talking to them about all that is happening, getting a sense of how they're feeling, knowing that they're adjusting or trying to adjust from what they're accustomed to a new life for the moment there. We had one-on-one session with the parents. We have two stakeholders there, meeting with the parents and having sessions there. Again, offering psychosocial support to the families. Here is where we had the little ones doing their little artwork, and we displayed it with us, with myself. You have the PAHO, another PAHO representative there, and we all work together. Again, as what Ms. Kendall would have said, that teamwork is necessary, and so with teamwork, we can collaborate and bring about a positive change. So with that, just want to say thank you. We come on to recommendations, sorry. So in recommendations, we'd like to resuscitate the MHPSS Technical Working Group. We'd like to have exchange programs, opportunities among technical working groups to share best practices, incorporate measures to improve flood resilience for future events. We would also want to flood interventions address the psychosocial needs of those affected by comprehensively incorporating the MHPSS principles that was mentioned before by my colleague, Ms. Kendall. And so with that, here ends our presentation. I'd like to say thank you.
Thank you very, very much, Sharon and Leanne. I think it was also a brief presentation as we were expecting. Thanks a lot also for taking care of the time as well, but also for sharing also those very important experiences also from the side of the coordination and this real integration also into some different sectors, as it is always a big challenge still in MHPSS. I think that you gave key elements that will be useful for other colleagues, for other teams working in the field, but also preparing themselves for other emergencies. So thank you very much. We are very well on time, so I'm glad that we can now have some time to be addressing some of the questions that colleagues have been sharing with us in Q&As, and even we would be probably be able to have a few minutes for some key discussions as we see. I would like to to start trying to follow a little bit the same order that that we had for the presentations, with a question to Inka. About it's quite I know that it's a question that could be quite general and it could take some time to answer, but at least we would like to address the question from the general perspective. Which are the biggest challenges regarding implementation in MHPSS from your global perspective? Inka, please.
Yes, that is actually a good question and a big question as well. I would say the challenges often lie with the allocation of resources. We have the guidelines. We have so many useful tools. We have guidance on coordination. We have psychological intervention manuals that are scalable. We have the WHO MH guidelines for training general healthcare providers, and we have the MSP. So I would say the guidance is there, but the implementation is often lacking behind. And I think this is where we need more of a push, including in preparedness as well. And the funding, of course. I would say in the last 5 to 10 years, there's a lot more attention to MHPSS by donors and also the humanitarian field, but we need advocacy. Every single time we need to advocate with donors, with governments. We need to educate on MHPSS, why it's important, why it needs to be prioritized across health, protection, education. This is where a lot of work is needed, and that's where it's often challenging to really bring people on board on MHPSS and finding the right people and the right stakeholders so we can support to take things forward. Yes.
Thank you very much, Inka. If, as we have a bit of time, if someone else from the panelists would like to add something to the answer, would be also nice to hear. So please feel free, just open your mic. Otherwise, I can continue with the next question. Okay, let's continue. We can always come back to that very big question. Thanks a lot, Inka. I think it was very clear, your comments. Voy a pasar una pregunta en español para
I will switch to Spanish. Question for Luisa, for Luisa and her team. I see that your work plan, the development of autonomy in communities, is good, but does this not take away responsibility to the state? And how do you see this program in complex situations such as an earthquake? The person asking the question is from Chile, and she or he sends her greetings. Thank you very much for the question, colleague from Chile. We work in a coordinated manner in implementation with agencies and local organizations to avoid any conflicts within the same place. And we need to always pay attention to working as best as possible without harming anybody. This coordinated work is fundamental, as is so the action of the MHPSS TWG, and there are different coordinations at the national level. And we at HIAS, as an organization working at a more local level in each of our implementation places. The country's reality is conducive to allowing all organizations to work without any conflicts between different organizations in the field. The support among organizations allows us to attain common targets in a healthier way, in a complementary way. It is essential to coordinate our work, and that is the first approach to communities We need, in that first approach, we need to identify actual needs and how are we going to coordinate. That initial overview before working in the field is fundamental. Now, when it comes to massive crisis situations, such as an earthquake, for example, we prioritize psychological first aid as a form of response. This type of intervention is more linked to sustained emergencies, as the Venezuelan reality, with an emergency that has been sustained over a long period of time. And the way to respond to these sustained emergencies is to generate capacities in the communities, to generate some elements allowing individuals to have psychosocial support providers in a very accessible way. I believe I have responded well to our colleague. Yes, thank you. In addition to what Luisa said, that has to do first in the coordination processes and to analyze a place where we will act, not only in terms of needs, but also in terms of structures, needs, resources, but also available response structures. And here, analysis is fundamental to identify existing gaps. And when we will conduct an intervention as an NGO, we should be able to strengthen the system, the state-owned system, the health system. And we know that one of the principles of our intervention is also not to generate parallel care systems. Rather, we want to strengthen the central system. This is a basic part of all of our work when it comes to empowering communities. That is to say, identifying that our actions are those that cover any health access gaps. And this community strengthening exercise is linked to scalable interventions of WHO, low intensity interventions responding to a very specialized level of care. So this allows us to unsaturate, so to speak, the systems based on the reality in each country and respond to the different cases in a more scalable way. Thank you very much, Luisa and Andrea, for your comments. I don't know if any of the panelists would like to add any comments as to this question. Otherwise, we will move on.
Lian and Sharon from Guyana. It's also quite a general question where it might be that other colleagues would be contributing with some responses. The question is, what advice can you give to address the challenge of insufficient volunteers for community-based MHPSS? Lian
Thank you for the
and
question.
Sharon.
I think we have to educate the population more and let them understand how important them helping can make a difference. Because oftentimes when we go into those communities, they don't know us as well as their community leaders. So when we can empower those community members and leaders to understand the importance of helping themselves, I think that can make a difference, but definitely awareness as well needs to be strengthened. So when we empower them enough to know what needs to be done, we need to create awareness campaigns that are not only at their level, but comprehensive enough so that it can be understood by all people within the community. And I think that allows them to embrace interventions better. And also they can now take on board, you know what, I'm in charge of this and I can make a difference for myself, even when the experts leave.
Thank you, Carmen.
Thank you very much, Lian. Any further comments? ¿Algún comentario más sobre la pregunta?
Any further comments about this question? Carmen, I believe that it is also important the way in which leaders trained to provide psychosocial support, how do they live their own reality with tools to address community difficulties, to address those difficulties by themselves. This is fundamental, at least as we have, to the extent that we have seen this in communities. When they live this personal experience using the tools, and they become in much more competent leaders to manage stress and distress, that makes it simpler for them to stimulate others to provide assistance. When we talk about MHPSS, a community-based MHPSS, I think that this is a cascade. As soon as the first individuals start participating in these sessions, they themselves take it upon themselves to extend that voice to other people interested in joining the groups about the importance of the tools to increase their quality of life and their welfare. This is fundamental. This is a lesson learned. The effects of psychosocial support over such a short period of time, these effects are so effective that they lead other people to want to participate, to see the same results and solutions to practical problems in their day-to-day life. Thank you very much, Luisa, for complementing this topic.
Since we have a bit more of time, we would have another question to Inka. Does what it was outlined in the WHO Psychological First Aid, PFA, remain valid based on what was mentioned in the first presentation? The question comes from Mexico.
Yeah, sorry, can you remind me what was mentioned in the first presentation that's valid?
It means from your presentation, Inka. I think it was just because you mentioned many resources, so I guess that they wanted to understand how PFA would be part of the package, no?
Okay. Yes, so psychological first aid is important to consider that it is a way of providing humanitarian aid, that everybody who is providing humanitarian aid, whether people are providing wash or nutrition or something else, should be trained in PFA and know how to respond to somebody in distress. It is not an intervention in itself. Although it's very important that people are trained, it does not treat mental health conditions. So it is one step in the right direction so that people who can provide psychological first aid can refer and connect people. And sorry, it's evening here, so this is my daughter joining me. Need to be trained as part of PFA to refer as needed to psychological interventions and mental health care. But PFA is definitely an important component of the humanitarian response. Over.
Thank you very much, Inka. It's nice to have your kids around. Is someone else would like to complement the answer? Fine, thank you. I would like now to do a general question to all of you that would maybe allow to have some comments, some brief comments that it's related to the voluntary work. La pregunta era en español.
The question is actually in Spanish, and this person says that it is problematic for that person that some people have to work as volunteers. Do you think that working as a volunteer or working with volunteers can be a risk? Or do you think that that is something positive? Could you comment on that? And perhaps I would add, not only is it important to work with volunteers, but we're working with the community. So could you comment on work with volunteers and the community? Luisa, could you perhaps respond to that first? Yes. I think it would be the other way around. I think that it's important for us to foster the autonomy of communities. We have to make sure that communities can solve their own problems. And there, especially in terms of mental health and psychosocial support, that is essential, especially taking into account what Andrea was just saying when she talked about the tremendous gap that exists between the needs that people have and the response capacity that exists. So it's absolutely essential, as I said, and I had the opportunity to work with HIAS as a psychologist. And when I went to the first community, I must admit that I was sort of afraid because I thought, okay, the people that are going to be interested, are people going to be interested in this topic? But the response was incredible in terms not only of going to the psychosocial support sessions, but these people turned into persons who found training, they learned, they took time to train, and then they became people delivering psychosocial support services to their own community. So here in Venezuela and countries in general, to the extent that people can self-manage, especially in MHPSS, that is important. It's not an additional burden. I think that the ability of acquiring this tool and to engage in practices of solidarity, of citizen coexistence, all of that is essential for communities. So I really don't feel that this is a burden or that it's a responsibility that cannot be taken on. Quite the contrary, it is strengthening our experiences as citizens, as members of a community. It's sharing with them tools that are important for their own lives. Also, you have to look at what happens at the individual level. For the individual, this is a tool that I apply to feel better and to accomplish things that are positive for me. And excuse me for going on and on, Carmen, but to the extent that people begin to better manage their stress as they become more resilient, they also begin to elevate their needs and get more benefits. So people that give in to stress, they tend to be isolated, living at home. They're not people managing their stress that go out, find a job, socialize, participate in support networks. So that allows people to improve their own lives. So that is my answer. It's not an additional burden, it's a solution. Not only does this allow me to feel better, but it also opens up a whole gamut of possibilities for me as a person and for me as part of a community. I wanted to add to what Lisa was just saying, and I think that a lot depends on the perspective. In the question, it said that we were there as volunteers, but we prefer to use community advocates, community promoters, depending on the role in the community. And a lot of this has to do with the principles of intervention in community-based mental health programs, strengthening the resilience of the community. These people can be protagonists of their own well-being. That is what Luisa was saying. These persons find greater sources of well-being, they have more tools to deal with adversity, and in that connection, what we're after is to strengthen agency on the part of the communities, so they can be empowered, defend their own rights, they can mobilize, and all of that can create structural change, and not in the other sense of the volunteers taking on roles that could perhaps be exercised by people that are part of an MHPSS. It is quite the other way around. We want to empower the community by providing it with tools, things that wind up being replicated, multiplied, but it's not in terms of facing an outside problem. It's more the need of strengthening the communities and allowing them to evolve. Thank you, Luisa. Thank you, Andrea. Sharon, Leanne, would you like to share
about the
Yes,
the
adding to
voluntary?
the team, I like the term that we coined here, which is a technical working group, which embodied so many ideas, so many tasks, so many skill sets. And when we hear of the group coming together, everyone jump on board. So volunteering here in Guyana, from our perspective, was not a challenge. Persons were eager, they were happy to know that they're helping. And like I said earlier, the team fearlessly provided the support to persons who were displaced. So coming back to what my colleague, Ms. Kendall, would have said earlier, in terms of the principles, we went out there with a robust plan. And once persons know that there's a plan that is working, I think that they will be eager enough to come on board to help in the process. Teamwork is very important, communication, and once everyone is aware that they're on the same page, they have a common goal and objective, I think that will help in the process. And volunteering, yes, sometimes it can be a challenge because of person's timing and the availability of the resources, but generally for us here within the Guyana context, it was a success. Over to Ms. Carmen.
Thank you very much, Sharon. Maybe Inka, would you like to provide some comments as well?
Yeah, I can just very quickly say I completely agree with what was said about volunteers. I think they're very, very crucial. I also just want to add, though, the aspect that we have to be careful not to overload them or not to use volunteers to replace what needs to be done as part of mental health systems. Many countries still spend 80% of their budget on psychiatric hospitals and institutions, for example, psychiatry, psychology. So I think at the same time, we need to keep in mind, how do we change and deinstitutionalize and make community-based care an integral part of the mental health systems where volunteers are a part of, but where we also have many paid staff who are part of the system and who know communities and have access to communities and can provide the care where people work and live and are there accepted as well. But I completely agree on the importance of volunteers. It's often an untapped resource. And just to add, the same goes with people with lived experience with mental health conditions who also have very unique expertise to contribute through volunteering as well, or through even paid work also over.
Thank you very much. Unless there is someone who would like to give some words, I think that more or less we have been able to listen to all of you. And I think there were very important questions that were complementary and adding to the presentations. We are running out of time. Voy a decir algunas palabras intentando con la
I have a few words to say, but of course it's always hard to summarize after hearing such rich contributions, but we have had the luxury of hearing from very experienced speakers, so thank you. The MHPSS approach for emergency preparedness and response means that we need to assess needs, we need to do intervention maps so that we can see what other services exist. This is important as a systematic effort. It's important to integrate mental health and social support in any humanitarian effort so as to promote resilience in affected communities. Therefore, an approach should be comprehensive. That is absolutely essential, and it means different types of support, local. Sometimes it involves international or outside support, but the idea is always to protect and to improve psychosocial support and to prevent and treat mental health problems. It is essential to have a system where we have preparedness and response with plans, with trained staff, with strong coordination amongst different sectors, health, protection, education, housing, and others that have been mentioned so as to satisfy the needs of the population, especially of those groups that are the most vulnerable. In addition to the community approach that we have reinforced today, we have to take into account life course, primary care, gender. All of these aspects are absolutely essential so as to provide an adequate response. During these interventions, we apply key criteria: avoiding harm, respecting human rights, and use the resources available so as to assure integrated support systems at different levels.
Many other resources are there, they are in place, but still there are a lot of challenges that need to be addressed. So we, with these kind of events, we are really aiming to be nurturing as well, this exchanging the experiences and trying to build up better, as it was mentioned as well. Emergencies in our region are unfortunately constant. As you all know, additional to long-lasting crises, other acute humanitarian situations are taking place, as in this moment, Hurricane Beryl, which has been affected, has affected the Caribbean. We would like to highlight our solidarity as well to support our colleagues in St. Vincent and the Grenadines, Grenada, Jamaica, and many other territories and countries in our region. Hopefully the information shared today could be part of this useful strengthening of the resources and the capacity for all the teams that are currently supporting the response. So thank you, Sharon. Thank you, Lian. Thank you, Inka, Renato. Muchas gracias, Luisa, también. Gracias a todas y todos los participantes. Y también gracias por los
I
comentarios.
wanted to thank all of the participants and also thank you for your comments. Please please feel that you should join us in future webinars. With that, have a good day. Thank you.